We're back and we're talking about prostate health, a small but crucial part in a man's body right below the bladder. But despite its size, problems can be serious. In fact, about 1 in 8 Canadian men will face prostate cancer in their lifetime, with around 60% of cases occurring in men aged 65 or older. Plus, over half of men in their 60s deal with something called BPH, and by 85–90% have it. BPH happens when the prostate grows bigger over time, and it's one of the most common health problems for older men. So what should every man know about their prostate? For this, we turn back to our panel, and Dr. Elterman, you are our expert in this at the table. So I'll start with this question. What are some of the signs that men should watch out for to know whether or not they have a problem with their prostate?
Sure. So remember, the most common thing that happens with prostates is prostate growth, which is a benign condition. It's not cancer. The main symptoms are going to be a weakening of the stream of urine stops and starts. There can be some straining. They don't feel they empty their bladder all the way. They may have to wake up at night to urinate. So these are the first signs of an enlarged prostate. And these are not symptoms of prostate cancer. Prostate cancer is typically a microscopic disease. It's not detected later because we have things like PSA screening, which is a blood test, which means we can find it earlier. So those are the main things that men should look out for with enlarged prostates, which is, again, these just changes in urinary symptoms.
Does the prostate ever stop growing?
Probably not. I mean, it's going to grow at different rates for different men, mostly because of genetic factors. So you could have 2 men who are 65 years old. One will have a normal-sized prostate, and one could have a prostate that's 5 times normal. So a little bit has to do with what you inherit.
So what is normal? What should a prostate look like as far as size, and what does it look like when it's enlarged? I know we have some visuals to support us, but maybe you can take us through this.
So a normal-sized prostate, we always talk about the size of a walnut. If you wanted a measurement, it's around 30 milliliters or 30 cc's, and prostates get bigger. So prostate enlargement is typically anything bigger than 30 mils. And as you can see from the graphic here, it could be as big as a ping pong ball or a golf ball, somewhere between 30 to 80 milliliters. And of course, prostates can get very large, and we're talking now into the size of various fruits, mandarin oranges, grapefruits. I mean, they can grow very large. And of course, we have different treatments depending on the symptoms and the size of the prostate.
But when is it a problem?
Size necessarily doesn't matter when it comes to symptoms. There isn't a direct relationship between how big the prostate is and symptoms. So you could have a little bit of an enlarged prostate and be very symptomatic, and you could actually have a very big prostate and not be all that symptomatic.
Okay.
So it really depends on the urinary symptoms and bother.
Is there a connection to prostate cancer? Does the size indicate any relationship to cancer?
They're generally thought of as 2 independent things, right? So one doesn't necessarily contribute to another. So you can have an enlarged prostate. Where there's a bit of confusion is that both conditions can cause your PSA, which is the blood test, to go up. So as your prostate gets bigger for benign, non-cancerous reasons, you're making more PSA. And also prostate cancer cells make more PSA than non-cancerous cells, and that's what causes the PSA to go up.
So speaking of screening, when should men start to get screened?
So there's recommendations from the Canadian Urological Association, generally speaking around the age of 50. You should go for a PSA test, and then it should be done on generally an annual or semi-annual basis.
What about a prostate exam?
That goes hand in hand. So one of the things that doctors can perform is an examination of the prostate, and what you're really looking for are any abnormalities, lumps, bumps, irregularities.
Is it difficult for men to talk about this?
I mean, being vulnerable is really the new courage for men. It's really a difficult thing to kind of get vulnerable and talk about things that are sensitive.
Do you find that with your patients?
I think there can sometimes be a little bit of trepidation, but I think most people have come around to the idea that they have to get checked out. Certainly by the time they've come into my office, they're accepting of the idea that they need to see a urologist and they have a problem. I think the big problem is the men out in the community who are not going to talk to their doctor, go see a family doctor, get a referral to a specialist, or even tell their spouse that they're having a problem.
So when does treatment for BPH become necessary?
Well, it really depends, again, on bother. There can be ramifications, like eventually you may not be able to urinate at all. You can go into retention, you can develop urinary tract infections, you can develop stones in the bladder. So there's some problems that can occur, but really it's when it bothers you enough, and then we can put you on medication. There's minimally invasive treatments, and then, of course, surgery.
For those who would like to avoid surgery, and I suspect that that would be a lot of people, what are the different types of minimally invasive procedures that are offered? I know there are some new ones out there on the market.
Yeah, so historically, we just had sort of a fairly major operation called a resection of the prostate and medications. There was nothing in between. And now we've come to market a number of new treatments. Some use a water, steam, or water vapor treatment, water vapor thermal therapy, called Resume. There's other things like prostate urethral lift or temporary stents. Resume has become a little bit more popular in Canada because it's much more accessible. It's a 3 to 5 minute procedure where they inject a small amount of just hot water or vapor into the prostate, and that heat causes the cells to essentially die and shrink down in size. So it's a minimally invasive way where you don't need to be hospitalized. You get to go home within the hour.
So this is what we're looking at right now, is that right?
Yeah, so it's a very small, patients get some anesthesia, first of all, and then there's a very small camera, a telescope that's placed inside, and a tiny needle is what delivers the steam into the prostate. So again, it's just a few 9-second injections, and you're in and out of the office.
That's also a new courage.
The fear on my face.
Exactly.
So as far as risk factors for prostate disease, and I know there's different types, prostate cancer being one of them, BPH the other, what should people know?
So, in terms of risk, age is the biggest thing. So all men eventually, almost all of them, as they get older, are going to have prostate enlargement. If you live long enough, you're more likely than not to have an enlarged prostate. And a lot of it is hereditary, a little bit with diet. So we know that there's a direct relationship between body mass index and your waist circumference. So if you put on extra pounds, it may actually contribute to prostate growth and urinary symptoms. And conversely, if you can lose a little bit of weight, your urinary symptoms can also get a bit better.
Well, I was just going to ask, key takeaway, what are some of the things people can be doing to maintain the health of their prostate?
I think just beyond the prostate into cardiovascular health, as well as specifically prostatic health, is live a good life, right? So it's always harder to treat disease than to prevent disease, right? I get all kinds of these patients who are, rather than prostate issues, having heart issues in combination with prostate issues. And so they say, I can't move and I can't enjoy my life. How do I manage this? And the answer is, generally speaking, live well. So weight loss, watch your eating, reduce your alcohol intake, good healthy exercise habits that keep your day-to-day activities your own, keep you functional and keep you able to enjoy your exercise capacity. I think those are the types of things that will not only keep people's prostate health in check, but in general, their quality of life as high as it can be.
I'll give you the final word.
Well, yes. Well, medications can help. They can have side effects. Albeit, maybe we should talk about tadalafil as it's something that can help symptoms of BPH. And it's one of those rare things in medicine that if you're taking it for that reason, the side effects can be a bonus for men because tadalafil being what's in Cialis. So if you're taking it to improve your urinary flow, which it can help, a side effect may be that your erections are a lot better. So that seems to be an unexpected bonus for a lot of guys.
All right, we'll end on that note. We've covered a lot of ground in this last chat. Coming up after the break, we'll shift gears and dive into an equally crucial topic, heart health next.